Doctors Without Borders, also known internationally by our French name Médecins Sans Frontières, or MSF, is an independent medical humanitarian organization. Founded in 1971, MSF won the Nobel Peace Prize in 1999. Today we have some 33,000 staff on the ground in roughly 70 countries. We work in communities affected by war, natural disasters, disease outbreaks, chronic neglect, and other crises. We treat people based on medical needs alone, regardless of race, religion, or political affiliation. On any given day, we assist patients who have no other access to healthcare services. Our medical teams can offer critical services such as surgery, maternal care, vaccinations, and mental health counseling. When people are forced from their homes, we focus on treating illnesses and injuries. We work to prevent disease outbreaks in refugee camps and other settlements. We treat malnutrition and the consequences of sexual violence. Our advocacy message is always the same. People at risk should be able to access health care, and medical workers, even in active conflict zones, must be able to provide it. And life-saving medicines and vaccines must be affordable and accessible to the people who need them most. The ongoing support of our donors, together with the profound commitment of our aid workers, will allow MSF to provide independent and impartial assistance to people in crises for a long time to come. We know that the future holds many challenges for people around the world, but we also know what's possible when we go where we're most needed with the materials we need to deliver life-saving medical care.
March 2020. The United States has issued a mass quarantine following the COVID-19 pandemic outbreak. This nationwide pandemic has left people without work for months, relying on unemployment for their financials. A nonprofit organization known as Doctors Without Borders has set up remote locations across the United States to make efforts to help those affected by the virus. In New York City, Doctors Without Borders have partnered with organizations to help find secure locations for the homeless and those who are housing insecure. In Florida, they have teams trying to prevent infection and control and setting up hospital triages to provide as much support and information in regards to COVID as they possibly can. Hi, my name is Sarah, and today I'm here to tell you why Doctors Without Borders deserves more support than what they get, and why we as a general public can make a difference by donating to this organization. What is Doctors Without Borders, you ask? It is an organization that's independent, which relies on 89% funding from the general public. This is a group of people, anywhere from surgeons, physicians, nurses, water sanitation specialists, midwives, anesthesiologists, and more, all performing under the MSF mission to provide emergency care to the people that need it the most. The mission of this organization is to honor the principles to provide assistance to populations in distress. This organization is based on the belief that all people should have access to health care, regardless of their gender, race, religion, financial status, and political affiliation. They work together to help people who face discrimination or who face neglect from healthcare systems to get the support and healthcare they need, without the inconvenience of paying a medical bill. These people work mostly on volunteerism, but can receive a low monthly pay rate based on expertise and experience. Doctors Without Borders is an undermined organization that doesn't get enough credit for their work. These people provide life-saving care to communities who face distress due to war, natural or man-made disasters, and they travel the world, leaving behind their families and their homes to assess our needs without the motivation of money. In 1999, this organization received the Nobel Peace Prize for their work with communities who were in danger. Today, we can make a difference by going to their website, www.doctorswithoutborders.org, and making a donation. If you can't donate your money, you can donate your time and volunteer. Remember, these people work together to save our lives out of the kindness of their hearts. Let's work together so they can continue to make their work possible. Thank you.